welcome back to Holistically Well. Today I'm joined by Grace, who is here with us from overseas. You're coming to us from Scotland, correct?
Yes, that's correct.
Yeah. So it is evening there for her, afternoon here for me. But the amazing thing that this podcast has opened doors to is literally being able to connect with people across the world. So we are very excited to have Grace of Natural Womanhood here with us today. And the topic is going to be all about fertility awareness, education, and restorative reproductive medicine options for women and couples. You know, these are topics that are broadly discussed or heard about, but when the reality comes in, is that it's not widely available in traditional medical settings for women and couples struggling with fertility. And so we are going to walk through Grace's story and help you understand that there are more root cause options available out there, even if it doesn't automatically appear like there is any other option other than IVF. We will go through more options for you to understand that are available and what you can do to advocate for yourself and your future family. So Grace, I'm so grateful that you're here. For those who haven't met you, can you share a bit about who you are and the heart behind Natural Womanhood?
Sure. Yeah. Thanks so much for having me on today, Kayla. I'm really excited to be on a new podcast. It's always great to meet a new audience. And yeah, so I am the editor-in-chief of Natural Womanhood. For anyone who isn't familiar with us, we are the online magazine of fertility awareness and women's health. We are the widest read publication dedicated to fertility awareness and what I think of as authentic women's health. So, women's health from the standpoint of your fertility, your cycles are not a bug, they're a feature of who you are as a woman. And so, advocating for care that treats women with that in mind, that keeps our femininity and our uniquely female bodies front and center in any kind of care that we receive. So that's what Natural Womanhood is about. And I feel like I should mention, if anybody's like wondering, she doesn't have a Scottish accent. I'm American. I am coming at you from Scotland currently. We're taking a year here while my husband does a master's degree, but I'm originally from Texas. We typically live in Texas when we're not living in Scotland. And Natural Womanhood is based in Texas as well, but we do have a global following. It's really neat. I just got back about a month or so ago from the International Institute for Restorative Reproductive Medicine's annual conference. And that was in Zagreb, Croatia. And it was absolutely just incredible to meet all of these people working in restorative reproductive medicine all over the world, and that so many of them knew about Natural Womanhood and the work that we're doing to just increase awareness on a global level around fertility awareness, the primacy of a woman's cycle in her health and fertility. So yeah, I love whenever I can talk to any new audience who might not have heard about Natural Womanhood or heard much about these ideas of body literacy, fertility awareness, restorative reproductive medicine, because I just think it's just magical when women have their eyes opened to the kind of care that they not only could be receiving, but what they actually should be receiving.
Absolutely. So, Grace, what personally drew you into the world of fertility awareness and restorative reproductive medicine?
My own personal story. So I have to rewind over a decade now. Really, it's been a while since I got into this work, and it all started with my own personal struggle with infertility. So I got married pretty young. My husband and I I was 22 when we got married, and I had this idea that he would look at me and I would get pregnant. I was like, I'm so young. We'll never have any problems. And I was even kind of afraid of just having one pregnancy after another. And so we had decided while we were engaged that we were going to use a fertility awareness method to space pregnancies. And we learned the Billings method largely because that was the only method we could find an instructor for at the time in our area. This was back before Natural Womanhood existed, and so there wasn't a one-stop shop, one website where you could go to and learn about what is this thing called fertility awareness? What is this thing called NFP? How do I learn it? What are the different methods? It was a lot harder to find resources back then. And it's funny to say back then because it's like only a little bit over a decade ago. The landscape has changed so much and for the better. But so we learned the Billings method, and this is a cervical mucus only method. So it relies on a woman observing and charting her cervical mucus as a biomarker of her fertility. So a sign that tells us where we are in our cycles, basically. Pretty quickly, I was starting to notice that my charts didn't look ideal. I was having some kind of abnormal symptoms, some brown bleeding towards the end of my menstruation each cycle. My luteal phase, so the time from ovulation to my next period, was a lot shorter than it should have been. I was having other symptoms, migraines, heavy bleeding, painful periods. And even though we pretty strictly tried not to get pregnant and so abstained during my fertile periods during the first 6 months of our marriage, around the 6-month mark, we kind of just decided to whatever. If you use a fertility awareness method, NFP, you're definitely familiar with the TTW, trying to whatever phase of things. And so we'd kind of started doing that around the 6-month mark of our marriage. And I thought, oh, this is it. I'm just going to get pregnant so quickly. But month after month after month was going by, and I wasn't getting pregnant. And I was starting to get a little bit panicky about it. Around this time, we also found out that we were about to be moved to Guam. My husband was in the Navy. Excuse me. And we found out we were going to be moved to Guam for the next 2 years. And it was really distressing because by then I kind of had an idea that something was wrong and that we were going to need help conceiving. And I wasn't sure that I'd be able to find the kind of care that I wanted on Guam. I knew that IVF wouldn't be an option for us, mainly for ethical and religious reasons. And it's since grown. My feelings about IVF have grown since then to involve more of an understanding of just how not great it is for a woman's body, but we can get into more of that later. But at the time, I knew from kind of an ethical, moral standpoint that IVF wouldn't be the way we would choose to grow our family. And I had an idea that this thing called NaproTechnology existed. So doctors who can use really detailed cycle charts to diagnose underlying issues with fertility. But I thought, okay, there's no way I'm finding a NAPRO doctor on Guam. They're hard enough to find in the States. And so I kind of resigned myself to the fact that we would just keep trying and see what happened, but that we were probably going to have to wait a couple years to get the kind of care that we wanted when we got back to the States. So lo and behold, on Guam, I end up meeting a physician who's trained. He wasn't fully NAPRO trained, but he had studied with NAPRO doctors and knew a lot of their techniques. And he started treating me, took a really deep dive into my cycles, suggested some different supplements that I could take, some different lifestyle interventions. And it was great because I felt myself getting healthier and my cycles started improving. I had less pain. My bleeding was a lot less heavy. My migraines were a lot less severe with each cycle, and just stuff was looking good. And then we started doing some progesterone support during my luteal phase. And eventually we conceived that way, but we miscarried pretty quickly, around 8 weeks. And then just happened to be, we were visiting the States at the time when we miscarried, and was able to see a fully trained NAPRO doc at that time. And he said, oh, I love what this doctor on Guam has been doing for you, but I'm going to try this other protocol and we'll go from there. And so he did added some HCG injections, which I think were after ovulation. I forget exactly what days after ovulation, but we conceived that very first cycle that we did that protocol. And so just did luteal phase, or just did continued progesterone support throughout that pregnancy, I think through 25 weeks or so. And then my son was born healthy at like 37 weeks and 6 days, just like right shy of 38 weeks. So, and now I have 4 beautiful, healthy children and have not had any issues since then. I do some progesterone support during pregnancy. But yeah, I just have become such an advocate for this way of doing medicine, in particular, this way of doing infertility care, because I saw the fruits of it in my own life, not just in the fact that we finally were able to conceive and have children, but because I saw what it did for my health to be treated this way. And as I've gotten older, in the past, and this was my son, our oldest, is will be 9 in February. So this was almost over a decade ago that we were undergoing all this. Since then, I've seen people go through IVF, and I see what it does to their health. I see what it does to not just their physical health, but their emotional health, what it does to their marriages, what it does to their finances. And it's heartbreaking. And I just want to have every woman know that that is not her only option, and it's not even her best option. And I think it's a real shame that not more women are made aware of that. And so that's a big part of our advocacy work at Natural Womanhood, in addition to teaching women the incredible value of charting their cycles for not only their fertility, but for their overall health and well-being, that seeing it as your 5th vital sign, but also the awesome care that you can get from a doctor who does view your cycles and your cycle charts as this 5th vital sign, this tool in their arsenal to really dig deep and uncover the root cause of infertility. Because at the end of the day, for so many of us, infertility is not a disease in itself. It's a symptom of an underlying issue. So that's a very long way of answering your question.
That is okay. No, thank you for sharing your story. I mean, I think there's probably so many women listening who see a portion of themselves at some point in your story. And I love how you highlighted that you first felt healthier. Like when the doctor on Guam started giving you recommendations to support your health that then reflected in your cycle, you felt more energy. You felt better. Yeah. And so for women who are seeing patterns in their cycle that aren't optimal, step 1 is first understanding your cycle, but step 2 then is learning how to interpret it. And if you are seeing that, my cycle's not really following what is a norm or a variation of normal, this is something to look into well ahead of even trying to conceive. And that's what I want to dive into next. Is preconception to me is not just right before trying to conceive. Preconception is before having any children, right? Yeah. And so for me personally, I would get 1 cycle a year from age 16 through like 20. And I was told, you're going to struggle to have children someday. You won't be able to have kids without assistance. You need to get on birth control, all of these things. And I said, I'm not getting on birth control. That's not solving what's going on. But I was able, through diet and lifestyle and exercise adjustments, to get my cycle to become regular. And thankfully, we were able to then conceive when we were ready in marriage. But so many women, I don't think about this until it's time to try to conceive, right? So let's talk about, for the woman who maybe she's in college or maybe she's dating, but she's not yet engaged and married, where kids are in the preeminent future, right? What are things that she can start doing now to help better understand her body and her cycle and feel in optimal health?
Yeah, that's a great question. And I just have to start off with a little anecdote that I was first really introduced to the concept of cycle charting and fertility awareness by a woman that I babysat for in college when I was 19 years old. I think it was like the summer in between my freshman and sophomore year. I babysat for this great family. And the mom, at one point, I don't know what we were talking about, but she asked me, like, point blank, do you chart your cycles yet? You should really start charting your cycles, because they used NFP. And I just was so taken aback. I was like, what? Why would I do that? Like, I've never even had a boyfriend before. Like, this is all so, like, what is she talking about? And now it's just so funny to me because with the work that I do, I'm that person now where I'm like, do you chart your cycles? You need to chart your cycles. I love being the one to now like dispel this illusion that it's only for women who are trying to get pregnant or trying not to get pregnant. And I
Right.
do think that, especially in, certain circles where you're like, yeah, I'm going to get married. We're going to have all the babies right away. Like, we don't need this NFP stuff. I don't need to chart my cycles. That there's a lack of understanding that NFP, cycle charting, fertility awareness, whatever you want to call it, might be the thing that actually helps you have all the babies that you want to have. And so the more body literate you are before the prospect of babies is in the picture, the better it's going to be, whether you want all the babies right away, whether you want something to help space babies, and just honestly, you never know what life is going to throw at you. You could have really severe financial troubles. You could have really severe health troubles, or your spouse could. And there will be reasons why you might want to space babies a little bit further apart or wait a little longer. And you just have no idea what life is going to throw at you. And we've been given this incredible tool to be able to still plan our families the way that we want to, the way that we're called to, without doing anything to inhibit or harm our fertility, while still being able to work with our bodies. And then if you do have problems that arise, you're able to work through them so much easier. Whether it's a problem in the form of your health and your cycles are wonky and you're not getting pregnant the way you want to, or whether it's a problem in your life and you need to, postpone pregnancy. You just automatically, when you have body literacy, when you've been charting your cycles, when you understand when you're fertile, when you're infertile, you just have such a leg up on anything that life or marriage is going to throw at you. And so I really like caution young women who think like, oh, I don't need that, or, oh, we'll deal with that when it comes. Like, don't wait. There's no reason to wait. The more you know about your body now, the better it will serve you no matter what life throws at you in the future. And it's so easy. Like, you don't even have to, you don't have to know all the rules for family planning, right? That all comes later. If you're going to be using it in marriage, and you're not intending to use it, to prevent pregnancy outside of marriage. Some people think like, oh, well, I'll just worry about that when, I don't want to have sex before I get married anyway, so I don't need to learn all that. You can learn to chart your cycles and pay attention to the signs your body is giving you without having to think about all the family planning rules that come with it. Oh, I abstain during peak plus 3 and blah, blah, blah. You don't have to be thinking that way early on when you're just learning your body. You're just learning your body. And the family planning stuff can come later if and when that's in the picture. But early on, just learning like, what is cervical mucus? What is a normal, healthy cervical mucus pattern? Does my cervical mucus look like a healthy cervical mucus pattern should? What's this thing called basal body temperature? Is my temperature rising appropriately after ovulation each month? What's a normal menstruation look like? How many days? How heavy? What kinds of cramping pain are normal or abnormal, and what can be done about it? And if you do have issues and you are able to chart them and get help from a doctor who understands your cycle as your fifth vital sign, then if you need to do something like get endometriosis surgery, you can do it at age 21 when you're in college. And then when you're married at, 25, 26 and trying to have a baby, you're not waiting a year to get in to an endo doctor who can treat you appropriately before you're able to conceive. So there's just immense benefit to giving women the tools and the understanding to be literate of their bodies, to be literate of their cycles. And we don't have to gum up the works with the family planning stuff early on. And it's funny because it's just for some people that just seems like I've given talks to young women at our school in our town about it. And at first, when some of the parents found out that I was going to be giving a talk about fertility awareness, they were like, wait, Grace is going to be teaching our kids NFP? Like what? Like, no. And I'm like, no, I will not teach your 14-year-old daughter's NFP. I promise. But I am going to teach them how to understand their bodies, understand their cycles, know what's normal, know what's not normal, and to empower them to get the kind of health that they need, that they deserve, should there be issues that need taken care of.
Yes, that should be a requirement in every health class, in every
Yeah.
high school throughout the board, and it's not.
Yeah.
But for women for young girls to understand that, because it really does, it starts then. And for them to understand, oh, like it doesn't seem like I'm ovulating at all. Like, and not from a wanting to get pregnant standpoint, but just, oh, if I'm not ovulating, is that because my body's not being nourished optimally
Mm-hmm.
or it's being
Mm-hmm.
over exercised, which I
Yeah.
think was the case for myself when I was a young athlete. I was just undernourished and over exercised for my
So
body,
common.
which
Yeah.
is so common. And
Yeah.
when I opened up about my story, if you go back to episode 1, 2 of the Holistically Well podcast, I shared my story, but I had so many current high school girls or recently graduated from high school girls reach out and say, oh my gosh, that's me
Yeah.
too. And so it's still going on. And I've been out of high school for over 15 years now. And
Yeah.
so putting the ball in your court where you can track your cycle, and I like using an app for that. You know, you have it on your phone and you can just start logging things. There are many free ones. The one I started with that is free is Ovia. It's OVIA. But I'm curious, Grace, do you have any recommendations for like a good starting point on where to just start tracking?
I am so old school. I still use a paper chart.
Okay, do you? Too funny.
Yeah, yeah. I just really I did finally dive into the FemTech pool and
Okay.
picked a FemTech device. I use a temp drop. It's the armband that measures my basal body temperature every night when I sleep. But I don't even use the app on that. I open it just to get the temperature and then I still record it in my paper chart. So
Too
I'm super old
funny.
school. I just really like being able to go back and like have this log of like this health record, basically. So I like that, but I know that a lot of people are looking for apps, and there are apps that will sync to your different femtech devices and that sort of thing. It kind of depends if you're using a method that's if you want to do something more than cervical mucus tracking, if you want to add temperature, then I think the Aura Ring has an app that comes with it, and I do think it. I want to say it might sync up to like natural cycles and maybe a couple
And
different
a couple other ones. Yeah, Natural Cycles
apps.
is one of them. I have the
Mhm.
Aura Ring, and I've shared this story, so if you've listened and heard this, you'll know. But I got my Aura Ring because my husband was like, "Oh, then like you can track your temperature, and I know you like tracking all of that and whatever." So I was like, "Thank you," and so I immediately just switched over after I got my ring
Mhm.
in April to using the Natural Cycles app. And
Mhm.
just completely ignored the over decades worth of information that was in my Ovia app, which
Mhm.
as the app gets to know you and your cycle, it starts to predict like when your fertile window
Yeah.
is, and it just gets to know your body and your typical patterns. And I had successfully used natural family planning to conceive and space our first 3 pregnancies. And I just totally like let that go. I was excited about this new technology and
Uh,
literally conceived that first week of having my ring
oh gosh. See, yeah,
unintentionally.
I tell women like, and this is actually what Marguerite Duane, so the founder of an organization called FACS, which is this fantastic organization that teaches doctors and med school students the science behind fertility awareness methods. So where Natural Womanhood kind of educates like the regular woman, the common, woman. They're educating the doctors and the future
Yes.
doctors behind the science. So we kind of have a little yin and yang thing going on with facts, but I love them for that. But Dr. Marguerite Duane says, women, you're smarter than your smartphone. And so when it comes to the app thing, don't throw out all the information that you have from, your method that you'd been using prior to getting your fancy new piece of femtech. And I like to tell women too that if you're using an app that is giving you a fertile window, that's predicting things for you, that's where I get a little bit suspicious. And especially if it's an app that's only asking for the dates of your period. That is not a fertility awareness method. That's the rhythm method. And if it's in an app, it doesn't matter. It's still the rhythm method, just cloaked in code. That's all it is. And so the rhythm method was kind of the very, very original form of fertility awareness. But it used it was a predictive method where it took a snapshot. It looked at a woman's cycles over the course of, I think, a year, kind of average length of cycles, and with kind of an algorithm predicted when you were most fertile during each cycle. And so it gets a bad rap, but it was actually about as effective as condoms are. Could be in like the 70-ish range of efficacy. Not great, but better than nothing. And again, it's like kind of about as effective as condoms are with typical use. So, but what I like to tell women is the rhythm method is to like Jerry Seinfeld's car phone. If you watch like old episodes of Seinfeld from the 90s, and he's got this big brick in his car phone. The rhythm method is to that car phone as the iPhone is in your pocket to like a modern NFP method. And so we can see the evolution there, right? There's a relationship there, but to say that they're the same thing is just wrong. Like the phone in your pocket can do everything. And all Jerry Seinfeld's car phone could do was make a phone call. So modern NFP methods are not predictive. Modern, fertility awareness methods are not predictive. They look at real-time biomarkers of your fertility. So what your cervical mucus looks like today, what your temperature looks like today, if you check your cervix, what your cervix is feeling like today. It doesn't predict for you when you might be fertile. It's looking at real-time fertility data. So if you're using an app that's only asking for the first date of each menses, that's the rhythm method. It's giving you a fertile window based on an algorithm that's basically the rhythm method. And then again, even if you're using an app that's using biometric data, so your cervical mucus readings, if you're putting those in, or your aura ring temperature or your temp drop temperature, I don't like an app predicting your fertile window for you. I think, again, I'll say Dr. Duane's thing, women, you're smarter than your smartphone. You can learn to read the signs of your body that your body's giving you every day and make decisions based on real-time data. You don't need a smartphone to be predicting things for you because our cycles can be unpredictable. Like stress can have a big effect. Illness can have a big effect on ovulation. And we tend to think of, it making our periods irregular, but that's not right. It makes your ovulation irregular when you have big episodes of stress or illness or something like that. So it signals to your body in the same way that over-exercising and under-eating signals to your body, like, oh, this is not a good time to ovulate. This is not a good time for us to get pregnant or or sustain a new life. So we're putting off this ovulation thing for a little while till stuff calms down. And so when ovulation is delayed, that's when your period's delayed. And so that can happen, and your app isn't going to know that that's what's going on, right? And so when you get to know your body, when you can understand how your body responds to stress and to illness, and you're checking real-time data, and you're using a method, then it's going to be so much more effective than any app ever could be. And so I like the ease of the app for just being a repository of your data, right? That's great. But you should be the one making the interpretations about your fertility from that data. I would not be relying on the app's interpretation. So that's my
Sure.
2 cents about
I
that.
think that's a great point. And I think these are tools. Like we need to remember the app is a tool, the Aura Ring's a
Hmm.
tool, and the temp drop, device is a tool giving
Hmm.
you feedback and then you interpreting it. Like I said, with
Exactly.
our first three
Yep.
children, like that is what I did. And I used the app as my tool. So
Hmm.
whereas you preferred pen and paper, you can still input things in an app and then be able to look at, okay, this was cervical mucus on this day. Okay, like you can still swipe back and look at prior months, so it can serve as this log for you. And for me, that was easier having it on the phone because I
Hmm.
knew where
Yeah.
my phone was at all times and we were
Yep.
moving and all of that versus like, oh, where is that paper document at?
Yeah.
So it's personal preference there, but to know if
Hmm.
you do switch, whether you're going from paper chart to an app or you're switching apps, to know that it does take 3 to 4 months of information for, you call it the algorithm, but which is probably a correct term, but for that device to understand your body's
Hmm.
biomarkers.
Hmm.
And you can utilize the app's feedback as a tool of, this is the predicted fertile window based on the cervical mucus you've input, and it will shift it. Like if you input cervical mucus a few days later than what you maybe did the last cycle, it'll shift your fertile window accordingly. So
The good apps will. Yeah.
the good apps will,
Yeah.
yeah, where they respond to the biometric data that you're
Yeah.
putting in. But
Hmm.
ultimately, yes, it is on you to make sure you're inputting it correctly.
Yeah.
But then also to understand, yeah, it takes about 3 to 4 months for it to start to understand
Yeah.
your cycle, your patterns, to more accurately give feedback on when that fertile window may be.
Hmm. Yep.
So we've jumped a little bit from that preconception woman who is not even thinking about kiddos and morphed into a little bit of the, okay, we're like looking at fertile windows and we're taking feedback from this, right?
Hmm.
So in your conversation a moment ago, you mentioned seeing information in your cycle. You start charting it and you're seeing that things feel off. And
Yep.
using the example of, she actually has endometriosis and needs assistance there. If somebody listening is having inconsistencies in their cycle and they think something isn't correct, where do they go? Who do they reach out to? What do
Yeah,
they do?
no, great question. Yeah, because the majority of doctors that you go to, you're just kind of run of the mill OBGYN is going to suggest birth control. That's the first line that they'll have for you in terms of menstrual cycle irregularities. And it's the greatest lie that women have ever been sold, I think, to my mind, that the pill regulates your cycle, because it 100% doesn't do that. It shuts your cycle down. It stops you from ovulating, which stops you from menstruating. So, ergo, you do not have a cycle. And some women will say, well, wait, I'm still bleeding on the pill. And I have to tell them, like, well, you are, but that's not a period. It's the withdrawal bleed that you're getting when you take your week of sugar pills, your placebo pills in your pack. And so that's your body withdrawing from the hormones and that top layer of your endometrium sloughing off. But it's not a true menstruation because it wasn't preceded by ovulation. And that might sound like semantics, but it's actually pretty important. And again, another lie that we've been sold as women is that we don't need our periods, that we don't need our cycles, and nothing could be further from the truth. Like, we actually really and truly need healthy, regular ovulatory cycles for our health and well-being as women. And it's super, super critical for teens. You're not laying down the proper bone density. It's interfering with your brain development, breast tissue development, cervical tissue development, immunological development. So many things are impacted by ovulation or the lack thereof. There's so much about our bodies as women, especially as we mature through puberty and into adulthood, that really, really rely on this cyclical ebb and flow of estrogen and progesterone that produces our cycles, that causes us to ovulate regularly every month. And so if you're not ovulating regularly every month, so if you've got this irregular period and this painful period and other symptoms, you might not be ovulating at all. You might not be ovulating as healthily as you should be. And these are things that, regardless, again, of whether or not you're trying to get pregnant, how old you are, whether you're in a relationship, you need to take care of. You need to have a doctor that understands that this is really critical for your overall health and well-being and needs to get to the bottom of it. You don't just need to be popping out eggs when you want to have a baby. Your body should be ovulating healthily and regularly as an adult woman, regardless of what your desire is for those eggs, right? And so the right doctor will understand that and will get to the bottom of why you aren't ovulating regularly or as healthily as you should, why your hormones are doing what they're doing. And yeah, it's super critical. And we have this series at Natural Womanhood called Reasons Women Need Periods, where we do a deep dive into what a healthy regular cycle means for heart health, what it means for brain health and development, breast health and development, cervical health and development. And it's interesting because, I think there's better awareness now than there ever has been about the side effects of birth control. Women are more open about that than they ever have been. And I think we get this idea that, it's like, you're taking something. And so taking stuff comes with side effects, right? And it's because you're putting something foreign into your body. So it's just going to cause weird things to happen. A lot of the side effects of the pill are not only just for what it's doing to your body, but it's because of what it's preventing your body from doing, which is ovulating. And so why do we see increased breast cancer rates? Why do we see increased cervical cancer rates? Why do we see mental health issues, especially in teen girls on the pill? And it's probably because they're not ovulating. And so they're not having the proper exposure. Their body's not having the proper exposure to their endogenous, so naturally produced estrogen and progesterone, which all these various organ systems and tissues across our body need to be healthy and to develop properly as women. And so I just think it's really critical to point that out. And it usually kind of puts this light bulb off in women's head about how critical ovulation is, because, we have this idea that our period is the main event of our cycle. It's the thing that you're taught to look out for, to mark on your calendar when you start your period every month. But the main event is ovulation. What we really want to know is, are you ovulating? Are you ovulating well and healthily and regularly? And so going to a doctor who's trained in either NaproTechnology, which is kind of the original form of restorative reproductive medicine. There are doctors who are trained in something called FEMM. That's another kind of flavor of restorative reproductive medicine. And then also NeoFertility is a newer one on the scene in the United States, started by a physician in Dublin, Ireland. So just not quite down the street from me, but a lot closer than it normally is. He has now started a clinic in the United States, and I think is going to be expanding their reach in the US now too. So doctors who are trained in these methods will do that deeper dive into your cycles and do the hormonal testing, do the ultrasounds, and if needed, do exploratory surgery for things like endometriosis in particular, or fibroids, and do some different surgical techniques where they're warranted there.
Absolutely. And, understanding that it's appropriate to reach out even if you're not yet trying to conceive, to the point that we said.
It's better to reach out if you're not yet trying to conceive. Don't wait. If you can save yourself the heartbreak of any of that, do it now. And we had this fantastic testimony by this young woman who's the greatest name, Merlot, who participated in one of our cycle mindfulness clubs on the University of Notre Dame campus. So Natural Womanhood has these collegiate clubs that we run where young women can get together and learn how to chart, learn body literacy, understand what's normal, what's not. And they're peer led. So we train a student who wants to run one at her university, and she goes back and she starts this club on her campus. So we call them cycle mindfulness clubs, and they're just like taking off and doing fantastic. And the girls in them love them because they're awesome. And so Merlot happened to participate in our cycle mindfulness club at Notre Dame. And through that, found out what might be going on with her body. She started putting things together like, oh, wow, my cycles have always been off and I didn't quite really realize it. I know I've always felt awful and my periods have been terrible, but I didn't really know that there could be a root cause reason behind that. I just didn't really understand the way it was impacting my overall health and well-being. And so long story short, you can read Merlot's testimony on our website, but she ended up getting endometriosis surgery at age 22. And even her parents were like, you're not married. You're so young. You're not trying to get pregnant. Why are you doing this? Well, her endosurgeon, she went to Dr. Patrick Young in St. Louis, Missouri, who's like one of the like top-notch endosurgeons in the country, told her, if you'd even waited a few more months, your bowel could have been obstructed. He was like, I probably would have had to resect your bowel. Everything was stuck together inside of her with endometriosis tissue, just sticking together, all of her pelvic organs. And he told her, like, thank goodness you came in when you did, because you might have actually saved your fertility for the future. Like, because of this, you might actually be able to become pregnant someday. And so how fantastic, right? I mean, it's terrible that she dealt with that as long as she did. I mean, she's been having a period since she was a young teen, and it took till she was 22 to get the kind of care that she needed. But how great is it that at least she was able to get that taken care of before the like desperation of, I want a baby and I want a baby now. Because any woman who can tell you, once you make that mindset shift from, I really don't want to have a baby, to, oh, I want a baby, all of a sudden it's like, oh, I really do. I want a baby. Why am I not getting pregnant? And then there's just this desperation that sets in, right? And each cycle that you don't get pregnant is heartbreak after heartbreak after heartbreak. And if we can prevent that, if we can prevent a lot of women from ever having to undergo that because they learned how to chart their cycles early, preferably as teens, that they got the care that they needed early on, just think of the heartbreak and the just awful health issues that we could prevent for so many young women, the quality of life that we could give teen girls and young adult women back by getting them healthy, regular cycles well before they're even thinking about marriage and babies. It just it's almost kind of staggering to think about, right? Like just the impact that could have.
For sure, which is exactly why I wanted to bring you on the Holistically Well podcast, because we are all about root cause, proactive care, and not reactive,
Mm-hmm.
And if we can prevent the heartache and the time, to
Yeah.
your story's point of, gosh, how long did she suffer with pain and was probably just told like, oh, that's PMS, like, oh, that's normal, right?
Mm-hmm.
And it's not. So if something feels off, it is worth looking into, and to
Mm-hmm.
know that the types of doctors that Grace has mentioned, NAPRO, reproductive medicine, FEMM, restorative reproductive medicine, to type that into Google, near me, see what comes up, and to understand, like, yes, they're going to be talking about fertility on their website, but it's because fertility is kind of that ending goal of the early
Mm-hmm.
symptoms that you're seeing. And
Mm-hmm.
so it's not just for those who want fertility because they are currently ready to conceive.
Right.
It's fertility is truly a sign of optimal health in women.
Yes.
And that fifth vital sign that shows us whether or not we have fertility is our cycle. And
Right.
so that is why it is okay to reach out for help before you are even ready for conception.
Yeah. And it's better. It's better
It's
to do
better.
it that
It's
way.
better. Mental, physical, financial, even, because
Mm-hmm.
had that patient, for example, waited even longer, it would have been a larger surgery down the
Yeah.
road and,
Yep. More recovery, everything
potentially a
else. Yep.
devastating surgery. Yeah.
Yeah. Yep.
So the earlier you reach out to early warning signs, usually the simpler the fix.
Yeah.
And thus you really are going to be saving money, but also pain and emotional trauma in the long
Yep.
run.
Yep.
So when we shift gears to now, somebody who really they are in that stage where they are trying to conceive and they're struggling, right? They are
Yeah.
not getting pregnant when they are trying to,
Mm-hmm.
what then? What, still reach out to those same types of teams, or, what are your recommendations at that point in her journey?
Yeah, I mean, if you haven't started charting your cycles yet, absolutely do that because I forget, there's a study that showed that even just having targeted intercourse resolves a lot for people because we aren't taught, right, that there's a very narrow window where you can get pregnant. So really like learning a fertility awareness method, understanding beyond a shadow of a doubt when you're fertile and when you're not. It's going to do two things for you. It might show you like, oh, we've actually been missing the boat every month. I've been doing LH strips, and we should have been having sex a lot more even prior to seeing the LH surge. A lot of women don't understand that, right? But you buy all those ovulation strips off Amazon. And, so really learning your body, getting that good body literacy, it'll do two things. It'll help you know when you're most fertile, and it'll start to uncover for you, oh, maybe I'm not so fertile. It looks like there might be some issues going on because my learning my chart should look a certain way and they don't. And so, for a lot of women, that can be a great first step is just gaining that level of body literacy, right? And then reaching out to a doctor who's going to really take into account what your cycles are telling him or her, what they're telling you about your health and your body. I think that's super critical before you even begin to start thinking about darkening the door of an IVF clinic. If you haven't done that very basic dive into, am I even fertile? Like, am I ovulating regularly? And it doesn't have to be guesswork. You can have a pretty good idea if you've got healthy, regular cycles, that you're ovulating well, right? So I think that's just the very, very first step, very basic step that a lot of women, they might think that they're doing by doing the LH test strips and using the clear blue monitor and that sort of thing. But again, it kind of goes back to what we were talking to about the apps, right? It's no replacement for understanding your own body and your own fertility. And then, just kind of the very basic stuff, the lifestyle and the health issue, the diet, lifestyle, health type of issues. And it goes for your husband too, right? Like, we're finding out every day more and more the impact that sperm has on fertility, on even if you are able to get pregnant. If your partner is not healthy, it can really impact how healthy your pregnancy is, specifically how healthy your placenta is, and that can lead to different issues in pregnancy, preeclampsia, all sorts of different things. So it's not just on you as the woman. Like your husband needs to stop smoking. He needs to get better sleep. He needs to cool it on the energy drinks. He needs to cool it on the beer, and other alcohol. He needs to be exercising regularly. Like he needs to be getting his testosterone up through good regular exercise. And you need to be doing those things too, right? Watching out for the inflammatory things, smoking, alcohol, getting good sleep. And it just sounds like so no brainer to people, but how many of us really do like take that deep dive and really make that commitment to doing, to making those really kind of difficult lifestyle changes. Looking at your diet. Are you nourished well? Are you eating enough? Are you eating too much? Just there's so much that we can do before we even have to start talking about like the more invasive kind of things. But what really freaks a lot of people out, especially when they're a little bit older, say in their later 30s, is they're like, well, I don't have time for that. Like I'm already at the end of my biological clock. I just need somebody to get me pregnant right away. And so
Yes, you
they'll
hear
they'll
that all the time.
immediately jump into IVF. And the IVF clinics welcome that. They tell you if you're over 35, you don't have to wait a year. Like we want you in right now. And so I think there's this pressure as you're getting older to like, well, I don't have time for all the lifestyle stuff to take effect. I just need to get pregnant right now. And so, yeah, you might be able to go to an IVF clinic and have them force a pregnancy, right? But is it going to be a healthy pregnancy? A lot a lot of IVF pregnancies, babies are born premature. There's complications. And not all of them, not everybody, but especially as you do get older, I really think everybody could benefit from just taking a pause, taking a deep breath, and asking themselves honestly, like, do I want a baby at any cost? Do I want a baby at any cost to my health? Do I want any baby at any cost to my future baby's health? Like, what do we actually want here? We want healthy moms and we want healthy babies. And the best way to do that is to get mom really, really healthy first, to get dad really healthy first, to correct anything that's underlying, any issues that are happening. Because guess what? If your abdomen is full of endometriosis, if you've got huge cysts on your ovaries, IVF isn't necessarily going to be all that effective. If you've got this insanely inflammatory environment in your womb, you're not going to have a baby stick, even if they can grow one in a petri dish for you. It's not necessarily going to stick in your womb if you've got all of that going on. And so no matter what you end up choosing, whatever route you end up choosing, it behooves you and your baby, your future babies, to get really, really healthy first. And that's just something that's really hard to do when you're doing IVF, because you're being injected with all sorts of hormones to make your eggs spit out, to make your ovaries spit out way more eggs than any woman's body was ever intended to do at one time. You're being put into artificial cycles so that it matches up when they're able to conceive embryos for you in the petri dish. It's just what I like to say to people to just kind of get them to sit up and pay attention is restorative reproductive medicine gets women healthier. Like, I got healthier because I underwent restorative reproductive medicine. Find me any woman who can tell you that she was made healthier by undergoing IVF. Like, those things don't go together, right? A lot of women, their health is destroyed undergoing IVF. Right. And I think that's an absolute shame. And it really just points to the fact that we need to take a step back and we need to ask ourselves, are we willing to just try to go for a baby at no matter the cost, to whoever we're talking about, whether it's mom or future babies, and realize that we all would do better if we just treated the underlying issues as best we could, got moms and dads as healthy as we could. And there are anatomical issues that even getting as healthy as you absolutely can will not solve. If you're missing vas deferens as a man, as some men do because of this very rare gene of being a cystic fibrosis carrier, not actually having it, but being a carrier, they're missing vas deferens. So they shoot blanks, right? All the restorative reproductive medicine in the world is not going to help that couple conceive. So there are hard cases where, yes, you are not going to get a biological baby no matter how healthy you are via RRM. And I think it's really important to acknowledge that, right? But at the end of the day, it still holds true that you're not doing your health any favors by undergoing IVF, regardless of the reason why you're doing it.
And at the end of the day, you will end up healthier from undergoing restorative reproductive medicine, even if an anatomical variation is found that will not result in a biological child, right? Mom's health, dad's health can still be optimized, and there are so many benefits to that across the board. So I think you just tied things up there beautifully of really understanding that difference between IVF and restorative reproductive medicine options, and to know it's never too early to reach out. It's also never too late, right? For the example of mom is 35 and she feels like she's running out of time and her only option is IVF. It's really not, because if you're not in optimal health and your fertility is not in an optimal place, it's going to be harder to conceive even through IVF, right? So knowing that you have options starting earlier is always better, and you can never start too soon, but to know that even if you are later in the game, you can't write off lifestyle changes that are going to optimize your health, and jumping straight to IVF is not your only answer, even if that is what the first doctor you go to tells you.
Yeah.
And so, Grace, thank you for sharing your resources, your insights today. I cannot believe that we've been talking for almost an hour already. It went so fast.
It
But is there
did.
anything else that you want our audience to know today, for the listener to know in regards to NaproTechnology?
Sure. Yeah. I mean, there are lists of doctors that you can find. You might have to travel to see them, but it's generally going to be worth it if you're really serious about getting to the root cause of your infertility. And I just think this is the direction that infertility care is moving. I think this is what women want. I think this is what couples want. And honestly, I just think we have to keep clamoring for it, because that's the only way that more doctors and frankly the market is going to sit up and pay attention and say, like, okay, we need to start offering this to women, because this is what they're really asking for. And just to underline that point, I have a colleague who was at the recent conference for the American Association for Reproductive Medicine, ASRM, which is basically kind of the lobbying arm for the IVF industry. They had their major annual conference a few weeks ago in San Antonio, Texas, and a colleague of mine was there. And she said at one point during a panel, the speaker asked, okay, so by show of hands, how many of you have patients now who are asking, okay, but what's my actual diagnosis? What's actually wrong with me? And so all of these IVF clinicians, REIs in the room, tons of them raised their hand, and they said that this is a wake-up call. This is a reckoning. Women are wanting to know what's wrong with them, and they're demanding that. Even the ones who are going to IVF clinics have this awareness now that, is this all that you can do for me? Isn't there more? Can't you figure this out? Women are fed up with being told they have unexplained infertility. And I just think there's just this massive sea change that is already starting, that's coming. And so don't be afraid to find that NAPRO doctor who might be an hour away and go see him, make the appointment, go see him or her, because that makes other physicians and med school students sit up and pay attention and say, okay, if this is something that women want, that couples want, and it's really helpful and it's really effective, maybe this is something I need to look more into. And it's going to really just change women's health for the better. So, and we can all be part of facilitating and pushing for that change.
Absolutely. The more we reach out for it, the more that it's seen as a need, the more it's going to continue to unfold with resources.
Exactly.
So speaking of resources, Grace, where can people learn more, continue to dive into this incredible information?
naturalwomanhood.org. That's where all of our articles are for our online magazine. It's where you can find out about the cycle mindfulness clubs I just mentioned. If you're a college student that kind of like perked your ears up, or you have a college student in your life who you think might be interested in that, we are going to start recruiting for our next round of leaders for colleges for next year very soon. So find out about that there. Our Period Genius program, if you're sitting here wondering, okay, how early is too early to start? I've got daughters. How early is too early to start talking to them about their bodies? We've got a program for that called Period Genius, which we actually crafted for girls 8 to 12, but can be used for girls who are even older than that, because again, it's never too late. So you can find out about that at naturalwomanhood.org as well. And that's also where you can find our podcast, or wherever else you get your podcasts, the Natural Womanhood podcast, which Kayla's going to be on, was on. We'll be releasing that episode in a few months. So yeah, but everything's at naturalwomanhood.org. And then you can find us on Instagram, Facebook, and wherever you get your podcasts as well. So.
Awesome. Well, thank you for joining us today, Grace. It is such an empowering feeling to be able to put this kind of education and information out there. And this is truly why I started this podcast, to connect with other individuals doing incredible work in the women's health field towards root cause, proactive care, and helping you learn the resources that are available, because sometimes the first answer isn't always presented with that first doctor's appointment, and you do have to advocate for yourself. And it can look like a longer journey than you want it to, but my goal is to make that journey just a little bit easier for you. So thank you for tuning in today. We'll be back again next Tuesday with more root cause women's health information to support you along your journey.